Hello, my name is Mariah Peterson. I am in Nursing 742 and I will be presenting on infant mortality. So, introduction to infant mortality. It is defined as the death of a child between 1 day of age and 1 year, but that also can go up to age 5. The most common causes and risks include maternal health, preterm birth and low birth weight, SIDS, injury, and geographical region. Many people do not know that infant mortality is still an issue, and many children still die before the age of 1. So the statistics of this, as of 2018, there were 4.0 million children globally. Of these 4.8 million, 75% of children deaths occurred within the first year of life, which, when you think about it, it's quite a few. In the US alone, the rate was 5.60 infant deaths per 1,000 live births as of 2021. And then the US has had a 3% increase in infant mortality since 2022, from 19,000 roughly to 20,000. So it's kind of an interesting trend that for the first time in quite a long time, the U.S. birth rate and mortality has increased. Another thing to consider is that ethnicity and race are two factors that must be considered globally and within the public health sphere. This is also an aspect that advanced providers should be mindful of and assess patients. The global aspect of this issue, my research found that the highest risk region for infant mortality is in Africa. Globally, infant mortality rate has decreased, though, from 8.7 million to 4.0 million. So even though it's the highest in Africa, it's still decreasing. And the main reason for these issues is just the lack of healthcare access and resources. So the most common cause of mortality, as kind of stated in the introduction, within the United States, it's birth defects, preterm birth with low birth weight, sudden infant death syndrome, pregnancy issues, and accidents. Again, so U.S. infant mortality has decreased in the last 10 years, except for the last year. Obviously, there's been a slight increase. And then other countries, the most common causes of death include blood infections, so sepsis, lower respiratory infections, and diarrheal diseases. So reducing the risk globally included improving access to life-saving interventions during pregnancy and delivery. Surprisingly, nutrition, 45% of the deaths are all due to malnutrition, which is horribly sad. Vaccination, and then again, improving access to healthcare and resources. The NP needs to be aware of the risk globally to help advocate within leadership for change and policies that could in turn affect other countries or regions. Reducing the risk locally, so education by providers that focuses on prenatal care and breastfeeding, updated vaccines, healthy pregnancy weight, substance abuse during pregnancy, and sudden infant death syndrome. And again, focusing on these can hopefully reduce that mortality within the United States. So the advanced provider role, specifically as stated by the American Association of Nurses, must assess and diagnose patients or situations, and then create a plan and implement the plan of care. They must then follow up and reassess with patients, and then also provide education and promote healthy changes. Anticipatory guidance. So, specifically for this topic of infant mortality, it's going to be those well child visits, making sure that parents know what is safe and what is not safe. The Bright Futures has very good handouts, in my opinion, on what to expect for each month of growth, essentially, and what to expect in the future. Also, it goes through kind of some safety things for each age group. So, like for your infant, you want sleeping on the back, so sleeping preventions, breastfeeding information, and then reducing accidents such as poisoning, drowning, and then ensuring car seat safety, making sure that young children are in the back seat and in a car seat that is installed properly. The Christian worldview is important in every aspect of the advanced provider's role, and that includes always having compassion on those seeking health care, treating others and patients as we would want ourselves or family members treated. And I think in our culture right now, it's really important as many parents are fearful of the healthcare system, and they have a right to be so. And so being open and honest with them and allowing them to ask questions, I think, is very important. I'll kind of end with a quote. So St. Basil the Great states, "A good deed is never lost. He who sows courtesy reaps friendship, and he who plants kindness gathers love." As providers, I think it's important to keep this in mind when seeing patients and to remind ourselves of this when we get caught up in all the busyness of the workplace and even the healthcare system. Just take a step back. Thank you. And that's all I have for this slide.